Coronary artery bypass surgery. We will study this under two heading: introduction and coronary artery anatomy. Coronary artery anatomy. Coronary artery, two types: left coronary artery and right coronary artery. Introduction. Before the 1950s, surgical attempts to treat coronary artery disease through augmentation of non-coronary flow to the myocardium was via the creation of pericardial or omental adhesion, which had limited success. From the 1960s onward, from the 1960s onward, the importance of aortocoronary saphenous vein grafts and the value of internal internal thoracic artery were increasingly recognized. From the 1960s onward, the importance of aortocoronary saphenous vein graft, aortocoronary saphenous vein graft, and the value of the internal mammary or internal thoracic artery were increasingly recognized. The outcomes of coronary artery bypass graft surgery were carefully monitored from the beginning, and by the 1970s, multiple large prospectively randomized multicentric trials were conducted. All these trials showed that a subset of patients had improved survival after surgery compared with other treatments. With the advent of percutaneous coronary intervention, with the advent of percutaneous coronary intervention (PCI), percutaneous coronary intervention or PCI. With the advent of percutaneous coronary intervention in the 1980s, the patient population undergoing CABG has changed, becoming progressively sicker, but often with the most to gain. Over the last decade, there have been major advances in PCI, percutaneous coronary intervention, including the use of bare metal stents, and the development of different generations of drug-eluting stents, as well as biodegradable stents, metal and biodegradable stents, in an effort to reduce restenosis. Although the role of coronary artery bypass graft in the treatment of ischemic heart disease has been questioned, a recent large multicentric randomized trial carried out comparing coronary artery bypass grafting to percutaneous coronary intervention with drug-eluting stents has clearly shown that coronary artery bypass grafting is still gold standard operation. CABG is still gold standard operation in the certain group of patients. In case of certain group of patients, coronary artery bypass grafting is a gold standard. Other more recent trials have confirmed these findings. only in diabetic and high risk patient. Other more recent have confirmed these findings mainly in diabetic and high risk patients. So introduction completed. Now coronary artery anatomy, right coronary artery and left coronary artery. Coronary artery anatomy. The coronary arteries are the branches of ascending aorta. The coronary artery is the branches of ascending aorta. This is ascending aorta. Coronary artery is the branches of ascending aorta arising from ostia in the aortic sinus above the aortic valve. Arising from the ostia in the aortic sinus above the aortic valve. The right from the anterior sinus and the left from the left posterior sinus. The heart, this figure shows the heart showing the distribution of the left and right coronary arteries. Number A, anterior surface of the heart. Number B, base of the diaphragmatic surface of the heart. This is ascending aorta, and coronary artery arises from ascending aorta. This is left coronary artery. This is left coronary artery, and this is right coronary artery. Left coronary artery. The left main coronary artery. Which arises from the aortic roots. This is aorta. Aortic roots can be the site of significant stenosis. Left main stem disease. This is the left main coronary artery. It can be the site of significant stenosis. In case of left main stem disease, carries the worst prognosis in terms of survival without surgery. The artery is inaccessible at its origin, and therefore grafts are anastomosed to its branches. The left anterior descending artery. This is left anterior descending artery or anterior interventricular artery and obtuse marginal branches of the circumflex artery. The left anterior descending artery is the most frequently diseased coronary artery. It is the most frequently diseased coronary artery and most often bypassed during coronary artery bypass grafting. Now, right coronary artery. This is right coronary artery. The right coronary artery passes from its origin anteriorly between the right atrial appendages and the pulmonary trunk. This is pulmonary trunk. This is right atrial appendages. And courses in the atrioventricular group and courses in the atrioventricular. This is atrioventricular, courses in the atrioventricular group around the margin of the right ventricle. Right ventricle. It usually forms an anastomosis with the circumflex artery at the junction of the right and left atria with the circumflex at the junction of right and left atria and the interventricular septum, the crux. Interventricular septum or the crux. It continues as the posterior descending artery or interventricular artery. It continues as the posterior right coronary artery কত আজকের
3 টাকা দিয়ে দিই।
আজকেরটা কত
কি কিছু
রুই মাছ ভাত আর ডাল
রুই মাছ বড় রুই মাছ 60-70
70 এখানে 120 আর 70 190 আর হলো 10 টাকা তোমার আগে 120 টাকা দরজাটা একটু আগাই দিও It continues as the posterior descending artery. It continues as the, this is right coronary artery, and it continues as the posterior descending artery or interventricular artery. Common sites of stenosis of the right coronary artery as its proximal portion or at the bifurcation or crux. In presence of disease at the bifurcation, in the presence of disease at the bifurcation, a graft can be placed distally to the posterior descending artery. To the posterior descending artery. The question of anatomical dominance is determined by the artery that supplies the posterior descending artery in approximately 90% of cases. The posterior descending artery arises from the right coronary artery. A pattern referred to as right dominance. The posterior descending artery can also arise from the circumflex artery. The posterior descending artery can also arise from the circumflex artery. This is circumflex branch of left coronary artery. A pattern referred to as left dominance, which occurs in approximately 70% of cases. A balanced pattern is on in which two posterior descending arteries on arising from the right coronary artery and on arising from the left coronary artery. This is posterior descending artery on arises from the right coronary artery and posterior ventricular branches which arise from the circumflex branch of left coronary artery. This is called balanced pattern.